many years, scientists have been interested in a syndrome known as PANDAS. And this is thought to be an autoimmune disorder that follows from a streptococcal infection that brings a new onset of prominent anxiety symptoms with both tics as well as separation anxiety and obsessive-compulsive features. Zhu and colleagues extend past research on pediatric patients with this syndrome and basic science research. And they do this by using animal models that inject antibodies from patients with PANDAS and examine the effects on striatal circuitry in the animal model. The new findings suggest that the antibodies seen in children with PANDAS bind to a certain subset of neurons in the basal ganglia associated with cholinergic function. And they also suggest that changes in symptoms in children following immunomodulatory treatments also change the binding properties of these antibodies. This provides important basic science insights that might lead to new thoughts about how to provide treatment for children with PANDAS. Considerable research demonstrates cognitive behavioral therapy to be an efficacious treatment for obsessive-compulsive disorder. There is also other research that outlines perturbations in brain function in patients with obsessive-compulsive disorder. In important new findings, Norman and colleagues bring together these two lines of research. They study patients with obsessive-compulsive disorder using brain imaging before the patients are enrolled into a randomized controlled trial that compares cognitive behavioral therapy to a supportive therapy for obsessive-compulsive disorder. And they use these findings from the brain imaging investigation to relate underlying dysfunction in the brain to the tendency to respond to psychotherapy. The important aspects of the findings are to suggest that there might be aspects of brain function in patients with obsessive-compulsive disorder that predict which form of psychotherapy the patients are most likely to respond to. And this is important both because it gives us insights in how we can connect biology to psychotherapy, but also because it gives us clues about particular forms of psychotherapy that might be most effective for particular patient groups.